On March 30th, 1984, Tom went in for his yearly dental checkup. As far as he could tell, there were no real problems except maybe the 1 or 2 usual cavities that the dentist always seems to find. The dentist began poking around at Tom's teeth, but soon became more interested in Tom's lower lip and gums. The dentist noticed an unusual growth in Tom's lower lip and asked if Tom was a regular user of chewing tobacco. Tom answered yes. After a series of tests, Tom was diagnosed as having a deadly type of oral cancer. Just 1 week after Tom's dental checkup, he had surgery to remove his cancer. This photograph shows Tom after his surgery. As you can see here, a large portion of Tom's lower lip was removed, extending downward towards his chin, and the area was drawn together by stitches. The surgery left Tom looking quite grotesque and disfigured, as you can see, but the surgery was not the worst part. Tom died just 1 month later. Chewing tobacco caused Tom's death. Due to the fact that I'm currently studying to be a dentist, and because my father is a dentist and I've worked for him as an assistant for over 4 years, I have actually seen cases similar to Tom's which result from chewing tobacco use. I've also attended a number of seminars on this topic, and today I'd like to persuade each of you to feel as strongly as I do about this terrible drug. In my speech, I'd like to show you the many problems that can result from chewing tobacco use. And then, I'd like to persuade each of you to take action and change the lenient laws governing the use of chewing tobacco in our society. Let's begin by looking at how widespread the problem of chewing tobacco really is. Chewing tobacco is more common than you may think. According to the American Cancer Society, 1 in every 12 Americans is a regular user of chewing tobacco. The average age of first use is just 10 years old, which means that when children are in just 4th grade, they are becoming chewing tobacco users. The American Cancer Society also reports that 40% of high school boys have tried chewing tobacco. And what's worse, 21% of kindergartners has tried this drug. Children are using chewing tobacco before they can even read the warning labels. Now you know that chewing tobacco is widespread, but you may wonder what could possibly happen when a person uses. Well, smokeless tobacco has multiple dangers according to the American Cancer Society and the American Dental Association. First, tooth decay and tooth loss can occur. Chewing tobacco contains grit and sand which tend to wear away at the teeth. It also contains added sugars to improve the taste, but these also wear away at the teeth, leading to cavities and tooth loss. Another effect of chewing tobacco is gum disease. Regular use of chewing tobacco causes visual damage in less than 2 to 3 months. According to the American Dental Association, about half of all teenage users has some type of gum problem. But what's wrong with gum disease? Well, it causes the gums to pull away from the teeth, which further increases the risk of tooth decay and tooth loss. Gum disease and tooth loss are serious enough, but as we saw in the beginning in the story about Tom, chewing tobacco can have more serious consequences. According to the American Dental Association, those who use chewing tobacco just once in a while have 4 times the risk of developing oral cancer than do non-users. And if that isn't bad enough, those who use chewing tobacco 3 or more times a week for more than a year have 50 times the risk of developing oral cancers than do non-users. This risk is even greater than that of smoking cigarettes. But unlike smoking cigarettes, where cancer develops slowly over time, chewing tobacco can cause cancer in teens and young adults as well. For example, Sean Marcy, a 19-year-old high school student from Oklahoma, was one of the most well-liked students in his senior class. Sean used chewing tobacco from age 12 to age 18 when he was diagnosed as having oral cancer during his senior year in high school. As a result, Sean had to have a series of disfiguring operations. First, 3/4 of Sean's tongue was removed. Then, all the muscles and lymph nodes on the right side of Sean's face and neck were removed. And lastly, Sean's jawbone was removed from here to here. As you can imagine, Sean was left looking quite grotesque. But this was not the worst part. For Sean was diagnosed at age 18 as having oral cancer, and Sean died just 1 year later. chewing tobacco caused Sean's death. I know this is a terrible thought, but the point I'm trying to make is an important one. You must be aware of the terrible consequences chewing tobacco has, because next time it could happen to you or to someone you love. Let's look then at what can be done to diminish the use of chewing tobacco. The laws in Wisconsin pertaining to the age which chewing tobacco can be bought must be strengthened. The law in Wisconsin states that chewing tobacco can be legally bought at age 18. But according to the Department of Law Enforcement, the laws on chewing tobacco sales have been ineffective. To be effective, the laws must be enforced and contain adequate penalties. A number of other states, including California, set the fine for selling chewing tobacco to minors at $1,500 for the first offense and $6,000 for a second offense. According to the American Dental Association, this law has cut the use of chewing tobacco by minors by almost 60%. I would like you to help pass a law resembling this here in Wisconsin. You must help stop people from selling cancer to our children. You can make a difference. You can write to our legislators urging a bill like this to be created here in Wisconsin. Lastly, use of chewing tobacco during all professional sporting events must be banned. According to the American Dental Association, the primary reason children develop an interest in chewing is because they see their higher role models doing it. These role models include parents, relatives, and friends, but more importantly, they include sports stars. Children see athletes as role models. Children think if it's all right for the athlete to do it, it must be all right for me to do it too. If these role models would just stand up and say, chewing is wrong, many of our children would change their mind about this drug also. What we need then is a ban on chewing tobacco use during professional sporting events. You may think this is impractical, but already one professional baseball team, the Kansas City Royals, has taken a stand. They have switched from chewing tobacco to chewing bubble gum. You can help influence other teams to do the same. I urge you to write to your favorite team or to your favorite athlete, urging them, individually or as a team, to take a stand against chewing tobacco use, as the Royals did. In conclusion then, I am pleading with each one of you to take action against the use of chewing tobacco. When you think of this subject, remember the problems of chewing tobacco. Remember Tom, and remember Sean. By adopting the measures I've discussed today, you can help stop what happened to Tom and Sean from happening to others.